My name is Dr. Harper, and I'm here to talk to you for a few minutes about numbness and tingling, which is also known as peripheral neuropathy. You see, I've been practicing in northern Utah for the last 12 years, and I've been searching for a way to treat chronic patients. You know, the ones that other doctors have had no success with and have basically given up on and told that they're going to have to live with the pain for the rest of their lives. Well, guess what? I finally found the answer. Now, it isn't just a pill, and it isn't just chiropractic care, and it isn't just supplementation. You see, what's so dangerous about numbness is that it's not like an injury, like a broken bone or a cut or a scrape. Numbness usually comes on slowly. You don't notice it at first, or maybe you just brush it off in the sensation thinking it's nothing, and then it slowly builds and builds. You start feeling numbness and tingling, you become more irritable, you start taking pills to get through the day, and then one day you realize you just aren't the same person that you used to be. And that's when you go to your family doctor to get checked out. If you were to go to your family or HMO doctor complaining about numbness and tingling, you'd probably hear something along the lines of, "You probably have paresthesia. Here, try these meds, and if they don't work, you might have to live with it for the rest of your life." You see, peripheral neuropathy can be caused by a lot of different things. Peripheral neuropathy affects millions and millions of people. In medicine, they might prescribe painkillers so that you become addicted to, or they might do lidocaine patches to deaden the area that you feel the numbness in. Or they may use an antidepressant or an anti-seizure medication to treat your problem. Now, every one of these treatments have side effects that you will now have to deal with. Now, is this the cause of your peripheral neuropathy because you lack medication in your system? If you take medication, you're only treating the symptoms of the peripheral neuropathy and not the cause. And if you're only treating the symptoms, the cause will never be taken care of, and you'll be taking the pills for the rest of your life. Let's find and fix the cause of your peripheral neuropathy. Then the symptoms will go away naturally. In my office, we leave no stone unturned to find out the cause of your peripheral neuropathy. You see, we not only look at you chiropractically, but also neurologically and for metabolic causes. Most people have been to chiropractors, so I won't discuss what we do chiropractically here. But let's talk about neurological problems and what can be done. First, we need to understand the nervous system and how it works. In the back of your head, right about here in your brain, is called your cerebellum. Now, in your cerebellum, all the information from your body has to go through that cerebellum. The cerebellum then takes the information and processes it, and then it sends it to the brain. The brain itself then takes that information, processes it again, and sends the information to your lower brainstem. Once again, the lower brainstem processes the information it receives and then sends it to the upper brainstem to keep it under control. Now, things can happen that flow of information is disrupted, causing the upper brainstem to go haywire. Well, what's the cause of the problem? Well, it's stress. It can be emotional stress, like a bankruptcy or divorce. It can be chemical stress, such as over-the-counter medications or prescription medications. Or it can be physical stress, such as a car accident or a slip and fall. One of the causes of peripheral neuropathy is when that upper brainstem gets out of control, causing a release of certain neurotransmitters, which then cause pain and numbness. Now, the pain and numbness causes stress, and that cycle starts all over again. Once you get caught in that cycle, it's almost impossible to get out without proper care and treatment. Well, in our office, we use brain-based therapy to treat patients, and we get amazing results. If this is the cause of your peripheral neuropathy, we can and will get you better. Now let's look at you metabolically. Is the cause of your peripheral neuropathy a metabolic condition? Well, let's find out and get you better. When looking at you metabolically, we use blood work that might include lipid panels, complete metabolic panels, immune panels, a CBC with differential, or hormone panels. We may do stool samples, urinalysis, hair analysis, gut function studies, or food sensitivity studies. By getting the whole picture with all of these tests, we will find the cause of your peripheral neuropathy. By using all these tests, we can design a treatment protocol just for you. There's no cookie cutter approach in my office, like you'd find in any other classical medical office. Not everyone is the same, and so not everyone is going to get the same type of treatment. In our office, we utilize nutritional products, brain-based therapy, diet changes, and lifestyle changes. To get you back to normal, we get wonderful results by using these protocols. As you can see, we really leave no stone unturned to find the cause of your problem, and then treat that cause. Once we find the cause, then we can find the cure. If you'd like more information, please contact my office and we'll send you an informative DVD and report for your review. There's never an obligation to receive this information. Call 801-416-8247 or you can leave a message at 888-772-0187 to request more information now. You can also go to my webpage at www.utahpndoc.com. Ask yourself the following questions. How long have I had peripheral neuropathy? And is my current treatment treating the cause or just the symptoms? How has this peripheral neuropathy affected my family, my job, my life? How has it affected my work and productivity? What is it worth to you, and what would you do to get your life back? Please request more information by calling 801-416-8247 or leave a message at 888-772-0187. Or you can look up on my webpage what I do in my office at www.utahpndoc.com. Let's get your life back and get you started on that road to recovery. My name is Dr. Harper.